Growing up, we were all required to take physical education classes, as well as for some of us, health classes too. Even here at Butler, we're required to take a physical well-being course that usually involves some sort of physical exertion. Coming in as a freshman at Butler, we're required to take an online training program called Red Cup Culture that discusses the use of alcohol and drugs and sexual violence, but never mentions mental health. Greater Good magazine says colleges provide orientation sessions on drug and alcohol use, sexual violence prevention, and health and lifestyle tips for students. So why not address mental health more directly? Mental and physical health are equal, but mental health is not talked about to the extent it should be. Mental health needs to be implemented in schools' curriculum the same way that physical education courses have been incorporated. In my mind, physical and mental health are equal. For example, stress is a common trigger for people who have mental illnesses, and as we have discussed in this course, stress can lead to burnout, and an excessive amount of burnout can lead to health issues such as heart attacks. Additionally, many studies have found that physical exertion can lead to increased mental health. The most important takeaway is that if physical and mental health impact each other as much as we say they do, why is all the emphasis being put on physical health? Since September is National Suicide Prevention Month, I feel that it is right to share some statistics with you. Psychology Today magazine shares that the second leading cause of death among college students is suicide, and the first one is unintentional injury. To be fair, some schools have picked up on this and implemented programs and resources for students to use. However, Psychology Today says that most of these programs are often inadequate. Butler has also done a decent job providing resources such as counseling services for students on campus. However, they're completely understaffed. In November of 2019, their first available appointment was in January of 2020. Now I will share my story and how my lack of education has impacted me. So it was my first finals week here at Butler University, and I started feeling a feeling that I've never felt before. I felt worthless and hopeless. I kept telling myself that with finals week approaching, I would just disappoint the people that loved me the most, and that I was worthless. I never considered myself to be depressed because I had a very great life, and I started to not care about anything at all. The next time that I talked to my therapist, as I did regularly, I found myself saying very concerning thoughts, such as, why should life go on, and it would be so much easier if I were just to end it here. Almost 2 years later, and I'm feeling much better, but I can't help but wonder, had I been more educated, could I have found better ways to cope? Or could I have gotten the treatment that I needed earlier? I always figured that depression occurred in people who had some sort of trauma occur in their life. I didn't realize that it was a chemical reaction that occurs in the brain and that anyone could experience it. I also now realize that everyone has mental health, but not everyone is affected by mental illnesses. So here are my suggestions. All universities should provide free health screenings to students. Greater Good magazine says that at Drexel University, they have mental health kiosks where students can answer questions and receive information on resources and support. Additionally, at UCLA, students can take a 15-minute online assessment and learn if they have mild to severe anxiety, as well as depression and suicidal thoughts. Above all, there should be a required program for all students to have to complete. If not during the school year, then a program similar to Butler's Red Cup culture. There should be no grades for this course, as the point is not to stress students out more, however, to educate students on mental health. Additionally, I think that there should be a paragraph in all courses syllabi addressing resources on and off campus for students. And this will be super helpful because school has been found to be one of the leading causes in the major increase of mental illnesses diagnosed. American Council of Education shares a quote by the president of the University of Texas at Austin. He says, "For students to be successful in academics and in life beyond college, mental health is just as important as physical health. It touches every aspect of life and affects us all." Thank you.